also we'll be launching our Sky channel very soon. You can also download our app. It's an e-cable app. And then right on channel 22, you will be watching us live wherever you are. We are back here again to discuss another exciting topic. My name is Christiana, as you already know. Today we are here to discuss a topic that I don't even know, but it's something that we should all listen. I think it's something that it can happen to anybody. And we are very privileged to have here a health professional. I'll allow her to introduce herself, and then we'll continue from there. You're welcome, madam. And can you tell us your name and then your profession, please?
Okay, so my name is Anita, Peasah, and I'm a nurse and a prescriber as well. And
okay.
I work with the NHS.
Okay, thank you very much, and thank you for coming.
Thank you.
And you're welcome to Great Television. Today we are here to discuss a topic known as thrombosis, and I would urge all of you to log on live on our Facebook page, Great Television. Send in your questions. If you don't understand anything, just send in your question, and our health professional here will be ready to give you an answer. When we talk about thrombosis, what is thrombosis?
Okay, so thrombosis is the formation or a presence of a blood clot inside the blood vessel. Okay. And it can either be in a deep vein or in the arteries. Ooh. So just in case like someone has a severe cut, and then naturally the blood clotting cascade is formed. But I don't want to go deep into that. So it's like protein plus fibrin is formed to naturally from the clot to prevent the person from bleeding. Ooh. So when this clot is formed and it's not done in a natural way, it can flow throughout the blood circulation, and it can be stored at one particular organ or anywhere in the body. So we have different types of thrombosis. So we have the deep vein thrombosis, and then we have the pulmonary thrombosis. Okay,
we'll come to them so that we get an explanation on that. So with this, what is the main cause? What are the causes of this thrombosis?
Okay, so the main cause, we have different type of causes, and then we have the risk factors as well. Okay. So the main cause of it is, one of them is sitting at one place, like you are stuck at one place for a long period of time. Especially the office professionals, they sit at one place, they don't move. And you can, because there will be lack of flow of blood through your lower limbs, so that can cause a thrombus, so which is the clot. Okay. And then certain diseases like cancer, long bedridden patients, patients with other conditions like the elderly, and then certain treatments as well, like chemotherapy. Okay. So, and then bedridden patients, they are really the risk. And then pregnant women as well, because when you are pregnant, there is pressure on the veins, so you're not able to, when you are pregnant, it's like you are just stuck at one place, want to sit at one place. So that if there is poor flow of blood, then that will be stuck, and that can form clots. And this can happen within a twinkle of an eye. Yeah. And then people who are heavily smokers, they are at risk as well.
Wow.
Yeah.
Wow. Wow. Okay. So how do you diagnose this thrombosis? When someone comes to you, how do you diagnose this?
Okay, so when a patient or someone felt like, I'm having pains at my wherever. Let's say the deep vein thrombosis is mainly on the legs. Or now it's coming on the arm as well. Wow. So when someone says, I don't feel okay, I feel very discomfort on my lower limbs and things like, they go to the hospital or they go to their GP, and then the GP will do various tests, like
Yeah,
they do
yeah.
blood tests, and then they might do X-ray. If it's in the lungs, then like they do ECG, they do scans. But then for one to go to the hospital because you don't know, you might feel like there is swelling of your legs, very painful that you cannot move. Ooh. You need crutches to actually lean on to walk. And then you can feel that you're at the back of your knee is very warm.
Ooh.
Yeah. And then the pain will push you to the hospital, either to your GP or A&E.
Okay. Okay. And you know, does it only comes when you are in pain, or when, you know, some people feel numbness in the legs as well? Is it also a sign?
If it's a continuous numbness, then there is a concern. But mainly the pain, and then the redness, and then the warmth, that will give you a sign. So when you get to A&E, then they will do the D-dimer. It's like a blood test. That's the first thing they will do. If it's a deep vein one, then they will do. Even with the pulmonary embolics as well, they will do a D-dimer to check. It's like a score table. So that when the results come, they take and check to see if you are at risk. If you score 2 and above, then it's like you are at risk of getting a clot. And then after that, they might do an X-ray or a scan.
Okay.
And then when it all comes positive, then they need to do something about it.
Okay. Okay. You just mentioned some types of the thrombosis, the DVT, and then another one. Can you tell us the difference and explain to us what the DVT is, and then we come to the other one?
So the DVT is the thrombus that occurs in the deep vein.
Okay. Is it on the leg?
On the leg.
Oh.
And then sometimes we have patients coming in with having DVT on the arm, but it's very rare. But the main one is the lower limb, and then it comes to the upper limb. If it comes to the upper limb, it's very risky. So it means that the clot can travel quickly to your heart or to your brain. And then you can get stroke or you can get heart attack. So we do have people say, oh, he slept, he didn't wake up. They say he had heart attack. Sometimes it's the clot that travels because the person is ignorant. They don't know what to do. And so with the pulmonary embolus as well, is the same as when there is a clot formation in the blood vessel and it's stuck in the lungs.
Oh, okay. So that one is from in the lungs. Okay.
So that's why we call it pulmonary. Yeah. So it's stuck in the lungs, and that the signs and symptoms of it, you become very breathless. You get chest pain, and then you get shortness of breath. You cough up blood. That is, coughing up blood, and you feel very anxious because you are not able to breathe.
Yeah. So these are some of the symptoms.
So these are some of the symptoms. So if you get any of these symptoms, even the chest pain, if it's consistent, you just have to make your way
to the hospital
to rule out at least. When action is taken earlier, you wouldn't know. I mean, you wouldn't need all these treatment, or it will not cause any further complications. Okay.
Let's check on our Facebook page. I can see some people are logged on. Welcome to Great Television, and thank you for logging on. Diana Kote Saki. We have Chima Tario-chan. She said that's a great sister. And then I have Eugene August Adote watching all the way from the US. Gladys Koko is watching as well. I have Jacinta Moana watching as well. Thank you all for logging on. You can send your questions on here, and then I'm sure our health professional will give you an answer. So I want us to talk about treatment on this, if for both the DVT and then the other one, what are some of the treatments?
Okay, so we have a lot of treatments, like We do have the injectables, and then we have the tablets.
Okay.
So, as I said before, when one makes their way to A&E because they're having chest pain, they don't know, and then they are being diagnosed, we have a lot of recent treatments that has come up that they might not need the injection. So treatment actually start from A&E. They do the risk assessment. And then when you need the treatment, they start. So it depends on the doctor whether to choose for you to take the injection or to start straight away on the tablet, because some of the tablets, when you start on it, you don't need the injections, and they are called the DOACs. It's about 4 tablets in one name umbrella. And then we have warfarin. I know a lot of people know about warfarin because warfarin has been in the system for over 50 years.
Okay.
And then we have the Tenzapari injection. Some trusts use heparin. So once the D-dimer comes as positive and they do the scan and they have the confirmation that you've got either P or DVT. So they start you on the injection from A&E, and then they will refer you to the expert, that's the anticoagulation clinic. So these medications are anticoagulants. So once you are, it's a confirmed diagnosis of a DVT or PE, you need to be anticoagulated. Now, if you are pregnant, then you will need the tablets, because when you are pregnant, you cannot have the tablet. So then they will start you on the injections. And it's not everyone who is eligible on the tablets as well. So you will have to have one-to-one. The doctor will have one-to-one with the patient, and then decide. They will all come into a conclusion of which treatment they have to take.
But are there any side effects on this medication when you take them? Like
so the anticoagulation tablets, the main side effect is bleeding. So we do proper counseling, and so the common ones are nosebleed. And then sometimes you might wake up having blood in your mouth, or when you're brushing your teeth so hard. We always tell our patient, don't go on the gum because you will be prone of bleeding. It will stop. So if you have to go on the warfarin, every patient, depending on your target range that the hematologist will range you on, will determine what level you have to be or how to start your medication. So the clotting time, mainly for everyone, is like 0. So like if you have a car, within a second, naturally it will clot, isn't it? But then if you are on this thinning tablet, then it delays. But most people are within 2 to 3 minutes, which means when you have a car, within 2 to 3 minutes, it will stop. So, but if it doesn't stop, you have to after 10 minutes, you have to make your way to A&E. And then they will reverse the bleeding. Or they will give you vitamin K to stop the blood by clotting it. So the main side effect is bleeding, and sometimes you might have slight headache. And then you might see blood in your urine, in your stool. So when patients come and we start telling them the side effect, they panic. But we always tell them that's why we are looking after you. So though you are in it, you are taking it, but you are not in it alone. We are all with you. So we reassure them. But that's the main side effect of these anticoagulation.
Okay, viewers. As I told you, we were discussing on the topic thrombosis. I hope we've learned a lot so far. We're going to take a commercial break from our sponsors, and when we come back, we will continue from where we stopped. So don't touch that dial. We'll be right back.
Ivory Party Hire and Event Planning is one of the UK's leading event companies. There are several event planning companies, but the best of the rest is Ivory Party Hire. Our specialty is creating quality, unique events with stunning delivery and integrating each and every element, from decoration, party equipment hires, event planning, etc. We provide a wide range of bespoke events, from private parties and weddings to conferences, product launching, charity balls, and high-profile special functions. Our team works all over the UK and internationally. Our creativity, passion, and customer service is second to none. Contact Ivory Party Hire and Event on mobile
07400071417. Email info@ivorypartyhire.co.uk. Website www.ivorypartyhire.co.uk.
Ivory Party Hire and Event Planning. Imaginary made real.
Welcome back to Yes to Healthy Life. As we were discussing on thrombosis, we just took a commercial break and we are back to continue from where we stopped from. We said a little about causes. I've been told we have unprovoked causes and then another one, provoked causes. Can we know the difference and what both of them do like?
So the provoked causes of the thrombosis is something that is bringing up for you to get the clot.
Oh, okay.
So it's like if you travel, you have a long distance journey in a flight.
Yeah.
You've never had the clot before, but because it's like over 12 hours flight, and then you just sit at one place. Some people don't even use, excuse me to say, the toilet.
Yeah,
they just sit at one place.
yeah.
By the time they land, because your legs are stuck like that, you are at risk of getting a clot.
Ooh.
So when you get that clot, when you come to hospital, we ask you, have you traveled before? Do you have family history? Have you had any DVT or PE before?
Yeah.
And all that. We ask you all these questions, and then some patient will say, "Oh yeah, I recently traveled to Australia," and then so that has caused that. And I just arrived like 2 days ago.
Oh.
So then we said, okay, that caused that clot. So that is provoked. Provoked is like something that has caused it.
Yeah.
And then the unprovoked is like you just there. You don't have any chest infection.
Yeah.
You've never been ill, but you just got the clot.
Wow.
So we take family history.
Yeah.
And we do take intense medical. We go into your medical history as well.
Okay.
And then if there's no reason, then the treatment, as you asked me before, the provoked treatments are most of the time different from the unprovoked
ones.
So the unprovoked ones, we treat the patient between 3 to 6 months.
Oh.
But then it depends on like your history, your medical history, and then your scan and all that. But the provoked ones, the provoked ones, sometimes we have to treat you more than 6 months. Sometimes you'll be on treatment for life.
Oh.
So another example for the provoked one are long bedridden patients. And then patients who have been to surgery, like to have hip replacement, knee replacement, major surgery, and they are really sick. So then they've got a clot either in the leg or in the lungs. So that is a provoke. So because the person did this, she's got this clot.
Oh.
But the unprovoked, as I said, sometimes nothing has happened. But then if you have had family history of maybe your mom, your dad, a sister, uncle, children has got a history of a clot,
yeah,
then it will be like a provoked.
Yeah.
Then the unprovoked, no family history, nothing, then we treat you for 6 months, mainly 3 to 6 months.
Okay.
But then after that, if you get another clot, then you'll be on treatment for life.
Oh.
Yeah.
Wow.
Because we don't want you to get any reoccurrence that can, because these clots can travel anywhere, especially the PE one, because it's in the lungs, you know, is closer
to the head and the heart,
And then when the clot travel from the lungs to the heart, then they get the irregular heartbeat, and then you can get heart attack.
Ooh.
But when it goes to the brain, that's where you get the stroke.
The stroke occurs. Wow. Yeah. Wow. Wow. I want to know, there's a question here. It says, what can I do if I have a high risk group for DVT? What can the person do?
Okay, so if the person probably the lifestyle, like the state of work that he or she does, if you are stuck at a place for a long time, in between you need to be mobilizing. You need to be drinking a lot of water. That will enable you to be going to the toilet, so that will enable you to actually walking. And then there will be free flow of blood circulating through your system. And then also, if probably the person do travel a lot, we always tell our patients, if you traveling, do not take any alcohol in the flight. Drink orange juice and drink a lot of water. And then that will let you go to the loo, and that will mobilize in you as well. And then if you are obese, you need to look into doing exercising. Effective exercise is very good, but not the exercise like what our boys do lifting, because all these lifting can cause
for the body,
troubles as well. And then if probably there is a family history, so she is at risk, then she has to look into her diet and all that. And then once she gets any symptoms, like chest pain or anything, pain anywhere, then she has to go to A&E or go to the GP. And then they can do there is a score that we've named it Well score. So they will score you, check if you have cancer, if you recently got ill, if you had any major surgery. So they will rate you. So if your Well score is less than 2, then you're not at risk. But then they will do the D-dimer, which is the blood test as well, to check your clotting thing, to see if you are at risk. And then if you are, then they will start you on treatment. But always there is a contributing factor that brings it.
And talking about diet, if you have this DVT and then the pulmonary one, is there any diet? Is there any specific food that you have to be eating to keep you on?
Well-balanced diet. You just have to. But if you go on the anticoagulant, one of them, which is warfarin, then the rate of your vegetables, because the vegetables naturally has got vitamin K. So vitamin K prevents us from bleeding naturally. So that's why we are all walking around not bleeding, because we eat our vegetables. It's got vitamin K. So there is vitamin K in the warfarin as well. So then, if you eat a lot of your greens, then taking the tablet as well, then you making your clotting risk factor very high. So we always tell our patient, before they say don't eat that, don't eat this. No, it's not like that anymore. You eat the same portion of vegetables, eat the same. But then if you are not on this anticoagulant, then you must just eat your well-balanced diet. Just flow in it. And then do exercising, walk a lot. Don't just stay at one place. You know, some people sit down and then they curve their legs for a lump, and then when they get up, they are like, oh, so that is you are preventing the flow of blood. So that can cause. So if you have a risk factor, then you can get the clot.
Oh.
And then if you smoke as well with the pulmonary, you are putting yourself
so
at
it's
risk.
Yeah.
So if you get any chest infection, quickly go and see your GP.
Yeah.
If it's something you need antibiotics, they might give you. If you're asthmatic, you have to look after yourself very well.
Yeah. Okay. There's a question. What are these blood thinners?
Okay, so these blood thinners are the anticoagulation treatments.
Oh, okay.
So when patients come, we tell them, you've got this diagnosis, PVT or P or AF. There are other conditions as well. So then you need to start on the anticoagulant therapy, which thins your blood. So it thins your blood. It's not that your clotting time is abnormal. No, it's normal. But it's just that we need to delay the clotting time. So instead of everyone's clotting time 1.0 second, mean when you have a car within 1 minute or 1 second, the clot has to form and the blood has to stop. But because you go on these thin tablets, that's why I said previously, everyone depends. If you have to go on the warfarin, some patients are between 2 to 3, some patients are between 3 to 4, and some patients are between 2 to 3. So then these thin blood thinners, that is the anticoagulant, so they are warfarin. We have the DOACs, which is about 4 of them in one umbrella name. So they thin your blood to delay the clotting. So like the patient who get heart attack and the stroke, it prevent, if you have the irregular heartbeat, the blood thinner prevents you from it prevents the clot to form. By making your blood very thin. So if you're on these blood thinners and you have a car, you will see that you bleed so much. Your blood is like, we tell patients, your blood is like water. So that's the causes of, that's the blood thinners. And it's not just the tablet, it's the injection as well. With that, tinzaparin or heparin.
If you've just logged in, we are discussing on the topic thrombosis, and so far we've learnt a lot about blood clotting and how to prevent stroke, how to prevent heart attack from all this. I want to take some messages from our Facebook page. You can log in on our Facebook page on Great Television. You can also download the e-cable app on your phone, your tablet, wherever you are, on channel 22. You see Great Television right there. Thanks for joining us, Kingsley Abeiku Taylor. And then Inji Uboma says, well done, girl. And thanks for logging in, Elizabeth Lamte, all the way from the US as well. Thanks for watching us. Alexandra CJ says, my lovely says, God bless you. God bless you too. And thank you all for watching. You can send in your messages and then you get your answers right after the show. Okay, where I want to ask, what happened to a clot that has embolized?
So they just flow in the circulation, looking for wherever to go. So when the blood vessel is blocked, that's why it forms the thrombus, and the thrombus just look for wherever, so it can stay on the leg, or it can travel it can come up to the thigh, or it can just travel to the lungs, and then to the heart, and then to the brain. Wow.
So with this blood clot, do they melt it, or do they use this tablet or this injection to thin them? Yeah,
to thin them, but not to melt it or to go forever. No, but you won't feel for some reason you will not feel the clot. But because your blood is very thin, so for some reason it goes.
Yeah. Okay, there's a question. It says, what causes a person to be at risk for developing deep vein thrombosis or the pulmonary embolism? Yeah, it says, what causes a person to be at risk for developing it?
Yeah, so family history. If a member of your family has
a
history, if they have DVT or PE before, you are at risk.
So it's
you
like
know,
a genetic.
Cancer, yes, something like that. When you go to and then they say, oh, is any of your family member has cancer?
Yeah.
Then yes, and then obesity, and then our lifestyles. Like you smoke, you drink, the state of work we do, pregnant women.
Yeah.
And then other conditions as well. And then when patients go through major surgery, so like if they have, as I said, hip replacements or surgical interventions, knee replacement, major surgery, they are all at risk of getting either the PE, or the clot in the lungs, or in the DVT.
Okay, and you know, most of the times,
and some medications as well. So like the chemotherapy.
Yeah, you said that, yeah. Well. And you know, when people go for surgeries, the surgeons give them these socks to wear. Yeah. Is it also for preventing blood clots?
It's for prevent because you are lying down for like maybe 3 to 10 hours depending on what type of surgery they're doing for you. So they put on the test stockings. Yeah, so it's part of the treatment to prevent the thrombosis.
Yeah, and how effective is that? Is that very effective with the socks?
It is very effective.
Oh, okay.
They don't just put it on you. They need to measure your calf and then see the right sizes. It comes in sizes, so the right size and then they put on you. They mainly put it on bedridden patients and then pregnant women as well. If you're going to go into labor or have cesarean section. They put, and then it's not just for that, probably when you are in hospital, after treatment as well. So when patients who are at risk, we advise them, you can get these test stockings from your GP or Boots, and then you can wear it in the flight because, you know, some are elderly, they cannot be walking around in the plane. So once you have that on, it's a peace of mind. But other than that, if after your treatment, whether 3 or 6 months, we stop the treatment. But patients do get reoccurrence. And that one, we have to put you on life treatment.
Okay. There's a question here. It says pulmonary embolism can occur without deep vein thrombosis. Is it true or false?
No, it's false because the deep vein thrombosis, it happens at the back of the leg, and then it can be upper
on the limb
as well. And then when it's here, it's very dangerous because it can quickly travel
up.
So usually when patients have they've been treated with DVT and then they get PE, we take it as one of the risk factors.
From the okay. And what about children? Are children also at risk of getting it?
No, but then now, you know, everything is changing now. So then when children are suspected having, we refer them to the pediatrician to look into. But children under 16, no.
Oh, they are not. So from 16
because they are very active.
Yeah.
You know, they play around and everything. So they are, unless the like the sickle cell patients, the severe ones, or congenital.
Okay. And another question says, who is at greater risk for pulmonary embolism? Is it men or women?
It's the women. Because, you know, we go through pregnancy and then we do a lot as well, you know, like you go through pregnancy, after giving birth, we put on weight and all that. I know men put on weight as well, but we have a lot of pressure, stress and things like that. Yeah, so the rates, women are high rate than men.
Women are more likely to get
a thrombus than men.
Okay. Can you tell us a bit, like, can you explain to us, because people want to know how bad the symptoms are, like when you compare the upper one to the DVT. Yeah, if you can tell us.
So the symptoms are mainly the same.
Oh, okay.
So, but with the DVT, because it's on the skin, so you get the swollen legs.
Ooh.
And then you get the redness, you can see. But if you are dark like me, but you still see the redness. And it's very hard. Very hard. And it's very warm. And then you cannot walk on it. It's very painful.
Oh, does it come out like a boil or something at the back of the leg?
It's not like a boil, but you get the whole back of the leg like that.
Is it like
it's not a blister, but you can get, like when you sit at one place, your feet swells up.
Yeah.
That's how it becomes. But this one is very hard. It's firm.
Okay.
And then it's like, I don't know how to describe it. You feel like something is pulling out.
Yeah.
And some of them are really in tears when they come in.
Oh.
And you see the redness.
Yeah.
And then you touch it. It's very warm. With the PE, so this is the DVT.
Yeah.
With the PE, you'll be having shortness of breath.
Okay.
So you'll be anxious and things like that. So I won't say that the DVT symptoms is better than they mainly the same. And the PE one is more risky because it's affecting your lungs.
Yeah.
And you know it's the lungs that helps us to breathe.
Okay.
So if there is a clot there, you cannot breathe. If you cannot breathe, you become very anxious.
Yeah.
You get agitated. You become very sweaty. And then things like that. And then you start coughing and things like that. So it's a very it can kill straight away.
Ooh. So is it something like a lifetime thing? Like when you get it, you were saying something about you get a treatment for 6 months.
Yeah.
If not, then it will be a lifetime thing. Does it stay with you for life? Like
no, it's just the treatment we gave you to prevent you any reoccurrence to happen. Yeah. So if you are young and you don't have no history, you are active most of the time, and the clot is not that bad, it's not huge, then they will treat you for 3 months.
Okay.
But if you are like over like 30 to 40 going, then they look, that's why they do really intense history, medical history,
they check family background,
social history,
wow.
You know what you do and all that. So based on all that, then they would take that. It depends on the treatment.
Yeah.
But if you haven't had any clot before, mainly it's like between 3 to 6 months.
Okay.
Then they will ask you to stop.
Okay.
But then most of the time patients stop, but then sometimes it reoccurs. So when it reoccurs, then you'll be on this thinning tablet for life. For life. Yeah.
Oh, okay. But the thinning tablets, you said it has side effects as well?
Oh, yeah. So, but it has side effect. The main side effect, because it's thinning the blood, isn't it? So the main side effect is bleeding.
Oh, okay. So you stop the clotting.
And then you get bruises. You get bruises. Well. And the bruises, it fades off after a few days. So we do tell patients, if the bruises hasn't bathed you from head to toe, then you don't need to worry. But if it's just one bruises there and there, but we do still get patients coming in. When they see one bruise like that, they want us to check
and see,
So we have a test that we do to check the level if you're on warfarin. We call it INR. So it's international normalized ratio.
Okay.
And then that determines your level of the medication. Then we either adjust your dose or we leave you on the same.
Okay, viewers. We are taking another short commercial from our sponsors, and when we come back, we will hear more from our health professionals. So don't touch that dial. We'll be right back. Again, we just took a commercial break and we are here to wrap up everything from our health professional. I hope we've learned a lot. I want you to tell our viewers out there, just give an advice on what to do when you get these symptoms, where to go to, like any information that is going to help the general public out there. So,
okay, yeah. So please, it's very important. I think I think you've really chosen this topic at the right time, because it's Thrombosis Week.
So okay.
So each time you find out that you're having a chest pain, you don't feel well, you feel like you're not breathing okay, please make your way out to see your GP or go to accident and emergency. If, let's say, you cough up blood, it might be just one time, maybe you're not bothered about it, but if it continues, please, it's very important. Prevention is always better than cure. Yeah. And then also we have to try and do a lot of exercising, especially those of us that sit behind the computers. I know sometimes it's very difficult. We get carried away and then we just sit there and just type. So you need to once in a while have a glass of water or a bottle of water with you. Drink a lot of water, and that will make you to go to the toilet. And this is all preventing any clots to happen, and it's making you mobilize a lot. And if you know that you've had a clot before, whether DVT or PE, you remember you are at risk again of getting the reoccurrence can happen. So try and do your exercising, eat well, look after yourself. If you are on the treatment as well, please take it as you have been advised, so that you can be on the medication and still get a clot.
Oh wow.
So with the warfarin, for instance, you can. So now with this new anti-coagulant therapy that has come in place, that's really good medication. So do take your medication, visit your GP or your appointments. It's very, very important. If you miss any doses, just carry on. But then if you haven't got any thrombos, we thank God for that. You have to look after yourself. When you're going on a flight, make sure you walk in it. You see some people standing. It's not that they are being inquisitive. They know why they are standing. So we need to all join them. And then eat well. And then if you are pregnant, you remember you are at risk as well. So mobility is very, very important. We shouldn't be sitting down at one place, crossing your leg. Most of the time you need to stretch your legs, stand, and then over. And this will prevent these thrombus, because we need free flow of blood through our blood circulation, which is very, very important.
Okay, thank you very much, madam. Thank you so much for your time. Once again, we've come to the end of another week, another edition of Yes to Healthy Life. As we heard from our health professional, we need to exercise, we need to drink a lot of water, and then take good care of yourself. Eat a well-balanced diet meal, and make sure where you work, if you sit down for quite a long time, make sure you get up at least and walk around, and that will prevent this blood clots, because we don't want to lose so many lives. We need to live as long as
smoke, you need to think about
and then smokers as well, you need to cut down on your smoke. And then drinking as well, you need to bring it down as well. So on today's note, we've come to the end of today's edition of Yes to Healthy Life, which was brought to you by Heduke Foundation, which is an NGO which creates awareness for various health issues. Next week, same day, same time, we'll bring you another exciting topic on Yes to Healthy Life. And with Heduke, we always say, your life matters, my life matters, every life matters. Thank you. Bye.
Bye.